Two of the new cases in Canada are a baby boy in Ontario and a child in Alberta. So that, of course, is raising questions about how this virus may affect pregnant women and also young babies, newborns. With a closer look, I'm joined now by Dr. Prati Sharma. Doctor, thanks for joining us this morning. What do we know about how COVID-19 affects young children and babies at this point?
Thanks so much again for having me on the show to discuss this very important issue. With regards to young children and babies, the data that we have so far that's predominantly obtained from the high contact areas such as China and Italy show that children and likely pregnant women are only going to exhibit mild to moderate symptoms. And children and pregnant women are probably at the same risk as the general population.
So yes, when we think about pregnant women, you know, obviously, if you're pregnant right now and watching this, concerned, are there any elevated risks, or you're saying not really, not at all?
Yeah, so what we say to pregnant women is that if they have any comorbidities or associated conditions such as high blood pressure in pregnancy, diabetes, any sort of significant illnesses, or if they're immunocompromised or have certain other medical disorders, you should certainly treat them with higher levels of caution, much like the general population and the vulnerable populations we talk about. Certainly, pregnant women are going to feel more at risk because they're carrying a fetus. However, the data that we've derived so far from studies that were done in China show that there is no vertical transmission to the fetus. The fetus is likely not exposed to any virus in utero. And the studies have revealed that in pregnant women who've been infected with the COVID virus, babies are born and the placenta, the cord blood, the neonatal throat swabs, as well as the breast milk are negative for any disease. However, I can understand how pregnant women would feel significantly more fearful about contracting the virus.
What about breastfeeding?
Yeah, it's a great question. There's no passage of the virus through the breast milk. However, we have to remember that contact is really the key way that this virus is transmitted. So if a woman does have COVID-19, when she's in close contact with the baby, she risks passing along the disease just because the baby is so close to her. So in an ideal world, the best thing to do would be for the mother to pump breast milk and then have someone else feed the baby that's not directly in contact with the baby. It's always an option to use formula for that 14-day window when they are sick and potentially in self-quarantine to avoid contact with the baby.
Dr. Prati Sharma, we appreciate your time. Thanks so much.
Thank you so much for having me on the show.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.